A warm hello to our returning as well as new Ascender parents. My name is Chris Locke, and I'm the Senior Vice President for Student Affairs and the head of school. All of us at the Academy understand that this is a trying time for everyone, especially our parents. We appreciate you taking the time to view this video, and we hope to answer many of your questions. First and foremost, we want you to know that our plan is to have students back on campus for in-person classes and athletic training beginning August 31st. We have been and will continue to work closely with Johns Hopkins All Children's Hospital, our on-campus health services provider, as well as the guidelines set forth by the CDC. As part of IMG Academy's extensive preparations for the return of students, staff, parents, athletes, the health and safety of everyone in the IMG community is our top priority. Current plans include mandatory masks on campus, frequent deep cleaning and disinfecting of rooms and high surface areas, ensuring that students are spaced out in areas like classrooms and the cafeteria, setting up a detailed screening process for students and staff as they come onto campus, and other measures to help us mitigate the risk of COVID cases on campus and any spread. We've had the good fortune of hosting campers on site since June 28th. This has enabled us to implement, evaluate, and improve many of our on-campus protocols. While we are still continuing to review and refine our plans and protocols based on the latest information and guidance available, we wanted to take the time to answer any questions you have in this video and know that things will probably change as the current situation evolves. With us today is Lynn Bluck, MSN and Clinical Manager with Johns Hopkins All Children's Hospital's Health Services Department on our campus, Scott Dean, our Senior Vice President and Athletic Director, and Phil DuPerry, our Campus Health and Safety Manager, who will be moderating today's panel. Phil, it's all yours.
Thank you, Chris. We'll start off with a couple of questions about our plans and protocols. Lynn, can you explain some of the precautions we have taken on campus to help do our best to maintain a safe environment for those who are here?
Well, we've instituted gate screens for anyone coming on campus. We do nightly bedtime checks of all our boarders. We have designated isolation areas for anyone who may exhibit symptoms. We do questionnaires of all the onboarding students and non-boarders who are returning to campus. We have daily disinfecting all high-touch surfaces at many times of the day. We have a specific protocol in place for any student who exhibits symptoms, for if they exhibit a fever or several symptoms that may relate to COVID. We bring them into health services for a full screening and then arrange for testing if that's necessary. If somebody comes back positive, we notify their parents and put them in quarantine for a minimum of 10 days after we get the positive results. We do contact tracing, and that those deemed that have been in close contact with the positive student, including members of their pod, will also be isolated for 14 days to ensure that they don't exhibit any symptoms themselves.
Well, thank you, Lynn. Our next question is, we've mentioned in our protocols that if there were to be a case on campus, we have specific isolation and quarantine areas. Can you explain where these are?
The first area is in health services away from other students. And we also have other areas designated on campus that we've reserved for isolation, and we'll notify parents where your student would be. The students that will, if they're in the isolation area away from health services, they're monitored by Johns Hopkins as well as Campus Life, and we'll check on their health as well as bring them food. The students are quarantined away from everyone else for a minimum of 10 days or 14 days, depending on whether they were a contact or they have symptoms. And this is recommended by county health professionals and the CDC. Parents and guardians are also welcome to come and pick up their student if you don't want to leave them here.
Oh, very good. Chris, this one's for you. Can you briefly explain what our pod system is and how it will work on campus?
Sure. The IMG student plans calls for pods, or the CDC would refer to them as cohorts of students who will train together, eat together, and be involved in after-sport activities together. So although we'll be employing safety measures such as daily screening of students and staff, utilizing masks indoors, frequent hand sanitizing, the close relationship of students within this pod or cohort will still likely be considered a household contact should one of the members of the pod become ill with COVID-19. Each sport is still working through the pod groupings at this time, but students will be grouped into pods by their sport, their age, which team they're on, or maybe what position they play. And at this time, we can't accommodate any requests for groupings within a pod. Now, the pod system cannot completely eliminate the ability of the virus to spread outside of a pod, but this has been recommended by the CDCs and others as a valuable tool in decreasing exposure to the virus and the potential spreading of the virus. It will be everyone's job on campus to ensure that our student athletes are doing their part to follow the rules put in place. Important ones are wearing a mask, trying to maintain social distancing, and frequent hand washing and staying within their pod.
Very good. Next question is, how will the rest of the pod members be handled if someone in their group tests positive?
Great, yes. So if a student is in the same pod as another student athlete that tested positive, that student, your student, and the remaining students within that pod will need to be isolated from other students and won't be able to participate in all of the regularly scheduled activities. Our aim is still to provide these students the opportunity for a modified daily sport training and other activities within their pod at the extent that we're able to do so. Current CDC recommendations require anyone exposed to COVID-19 to avoid contact with others outside of their household for 14 days. So even if a student tests negative, this does not negate or eliminate the need for a 14-day quarantine. Currently, the Florida Department of Health does not recommend testing anyone who isn't currently presenting COVID-19 symptoms. So we will continue to monitor these CDC and Department of Health recommendations and adjust accordingly. As far as school is concerned, if a student does have to isolate and can't attend class, we are confident that our teachers are equipped to help students catch up and keep them up to date on classwork. This is what we do. On average, our student athletes miss somewhere between 2 and 8 weeks of school for instruction, so we feel that we're very well prepared to support our student athletes. And we're going to learn from some of the experiences we had with distance learning to create some best practices to help students stay connected if they're unable to attend class.
And Lynn, one back to you. Are masks mandatory on campus?
Yes, masks are expected to be worn by all students, by coaches and staff members, and visitors while on campus and indoors or anywhere that are in close proximity to others. This includes the classrooms, walking in the hallways, in the dorm hallways while you're doing extracurricular activities, in the cafeteria before and after you're finished with your meal. And the mask can be taken off while you're eating, while you're doing your sports practice, and in your dorm room alone. However, if someone comes in, you need to have your mask on. If you have a medical condition that prevents you from wearing a mask, please reach out to your advisor and let them know.
Very good. Another one, Lynn. Many parents have asked if COVID-19 cases are confirmed on campus, will all parents be notified?
We don't disclose any health or personal information about employees, guests, or students to the public per our protocols. We wouldn't notify every parent of a particular positive case. If there's a case on campus, we follow the CDC recommended guidelines and conduct contact tracing of all the close contacts. Per the CDC, you'll only be notified if your child came in close contact with someone who had a confirmed case of the virus. Close contact is currently defined by the CDC to be less than 6 feet apart, regardless of whether you had a mask on or not.
Very good. Now over to sports. Scott,
Yeah.
how will practices be run? Will students be in their pods for the whole time? And will they have to wear a mask?
Yeah, so Phil, the practice is going to be very, very similar to what we've done in the past. We're going to try to keep things as normal as we've had done prior. The changes will be they're going to have to wear their masks, as Lynn said, to and from practice. They won't have to wear them while they are practicing. But that's we want to keep this as similar to past experience. So they will train in their pod. There may not be as much ability to merge with other groups and that kind of stuff. But again, safety is our utmost responsibility at this stage.
Scott, will students be able to participate in games? And what does travel for games look like this fall?
Yeah, for games, we're going to be able to participate right away. So currently, FHSA guidelines have games kicking off in September. Our league play have games kicking off in September as well. So currently, we're full steam ahead on those activities. As far as travel goes, we're still kind of working out those details as to how we will go to and from games and how we'll do distancing and how we will travel. If by chance we have cancellation in leagues or in FHSA games, the great thing is we've developed an internal competition structure. So every sport's going to have a built-out, complete fall season that will allow the kids to participate, get game film, get statistics, go live streaming. So we'll be able to go and share all that with potential college coaches.
Excellent. And related to that question, if we play other teams or other teams come on campus, will they be screened with the same scrutiny as our players?
Well, we're going to share all of our guidelines with our opposition, and that the expectation is that they follow our guidelines to a T. They're going to have to wear masks when they come on campus. If they have athletes that aren't feeling well, is not to bring them here. But while they're on our campus, our expectations is that they're going to follow our guidelines as closely as possible. Just the end goal to keep our student athletes safe and healthy.
Excellent. A lot of folks know that the WNBA is on campus and will overlap time there with the academy students. How are these two groups interacting, if at all?
Yeah, it's really limited. It's really there's zero interaction, and that's really the first design by the WNBA to keep their players and their coaches and admin people in kind of their own little internal bubble, so that they don't have a lot of interaction with our students. So, we've actually created a new facility for our basketball teams to train in, because the WNBA is going to be using our current facility for a month or so. So the interaction is I don't want to say it's completely non-existent, but it's as close to being non-existent as possible.
Excellent. And last one, Scott, for you, will pods be the same in the classroom as in the sport? Yeah,
so that's something that we're still building out. Me and Chris are working together to make sure that we come up with the best scenario. It's a little bit difficult because we know the amount of different classes that academics offers, and so we're not always going to have the same kids in the same pod in the same classroom. But the idea behind it is to kind of take what we've done over camp, use best practices there to come up with the best and safest solution to make sure we can deliver both academically and from the sport perspective.
Excellent. Thank you, Scott. And back over to you, Chris. Will boarding students have interactions with non-boarding students? What will protocols be in place for non-boarding students?
The boarding students will have interactions with non-boarding students that will occur in their sport pod, and it'll involve interaction with non-boarding and boarding students sometimes in the classroom. However, we do have strict policies in place for those student athletes that are non-boarders coming to campus each day. They'll be screened at the gate and asked a series of questions regarding their health and that of their household contacts.
And will class be in person, online, or hybrid?
At this time, classes are going to take place in person on campus. If a student is international and they have a requirement and a government order to self-isolate prior to arrival or have to miss traveling at the school year because they test positive or there's an issue obtaining their visa, we just ask that the individual family reach out to their sport advisor so we can discuss how classes and sports will look for that each individual situation.
Good. What safety measures will be put in place in the academic building and in the classrooms?
That's a great question, and it's one that we're continuing to work on, but we feel right now pretty good about, but we'll continue to evolve. Scott alluded to it a little bit before. In our classes, we try to keep our class sizes small to begin with, where we don't normally like to have a class greater than 18. We're hoping to drop that by 1 or 2 students this year, but in order for us to have some interaction and some group work and things, we plan to have the pods. So basically, if we have a class where there's some soccer players, they may be sitting a little bit closer together than 6 feet and able to work on with each other, but there'll be distance between that group of soccer players and maybe a small pod of tennis players. And off to the left, maybe there's a small pod of football players. And then in the other corner, there's basketball. So there will be the opportunity for students within that pod or sport to be a little bit closer together, but we'll maintain the appropriate distance in the classroom between others. As we've mentioned before, we are going to require that masks be worn by students in the classroom, within the building. In addition, we've put markings on the floor to try to have the hallways move in single directions. We've clearly delineated the stairs because that's another area where students come together. Teachers will also be wearing face coverings, but when they can maintain an appropriate distance, if they're doing an initial direct delivery or lecture, they may wear a plastic face shield, but if they have to get closer with the students, then they'll put their mask up as well. We are going to require that students and teachers, every time they leave the class and come back, that they either wash their hands or they use sanitizer. To facilitate that, each classroom will have a little sanitizing station with hand sanitizer, disinfecting wipes, extra masks in case someone using one of the surgical masks and it breaks or something happens to their mask, we'll have a replacement for them. In order to avoid students and teachers having to touch door handles and things between classes, we plan to prop those doors open at the end of class and keep that open as students filter out and then come back into the next classroom. And then lastly, and most importantly, we do have deep cleaning protocols in place so that each evening we'll be able to maintain, a very clean school. And we don't believe that if there is an issue, we have the right protocols in place that we'll have to actually cancel school. We'll obviously continue to follow CDC guidelines, local Department of Health if need be, but we feel we have the right protocols as well as cleaning supplies and things to ensure the safety to have class the next day.
Thank you, Chris. One last question about access to the student athletes. What if I am local and need to sign my child off campus for a doctor's appointment, or I want them to spend the weekend with their family?
Absolutely. The normal off-campus trips we take are discontinued, and only a parent or guardian may sign a student off campus. While they're off campus, our request is that the parent and the student athlete continue to adhere to social distancing guidelines, wear a mask, and frequently wash their hands. But of course, we can't usurp the rights of the parent to see their student. When the student does come back to campus, they'll go through the Johns Hopkins screening to ensure that there aren't any issues, and we will continue to monitor our off-campus policy as local conditions change and implement them when appropriate.
Very good. That is all for today. Thank you, panel. We know that this doesn't cover everything, but we appreciate your patience as we continue to map our course for the 2020-2021 school year. Please be sure to continue to check our COVID-19 and boarding school pages on our website for the most up-to-date information, as well as frequently asked questions that will be added soon. We hope to continue to make these videos. Please continue to send your questions to the advisors, coaches, and our parent relations director so that we can get them answered for you. Thank you.